Additional witnesses in support, please state your name, organization, and position only.
Greg DeShere, the Arcing United Cerebral Palsy California Collaboration, the Developmental Disabilities Group in support.
Kobe Pizzati with the California Association of Psychiatric Technicians in support.
Doug Chiappetta with the Union of American Physicians and Dentists with AFSME in strong support.
Stuart Thompson, California Medical Association in strong support.
Additional witnesses in support? Seeing none, witnesses in opposition. Please come forward. For those that have substantive comments, you have 2 witnesses at 3 minutes each. Maximum. You're not required to use the full time. And then we'll go to witnesses, additional witnesses in opposition, and ask only for the statement of name, organization, and position. Please proceed when you're ready.
93 or 94 or both?
1193.
Okay, well, I was prepared to talk about 1194.
Okay, so we may have some other witnesses take her place, but I'm Lucinda De Rossi. I'm the Public Policy Coordinator for the California Association of Social Rehabilitation Agencies. I represent 31 organizations across the state, and we are the people, we are the agencies who actually county behavioral health systems contract with to provide services for those people most seriously impacted by psychiatric illnesses. I myself was also a provider, a psychosocial rehab provider for many, many years, and a manager and an executive director of one of these CBOs. What I wanted to mention today was that I understand that Assemblyperson Eggman is very well intended, and I understand that all the people that are in support of this bill are very well intended. However, some of the information is misinformation, and we need to really be really clear about what we're doing. So what this bill will do is basically force the conversation at the county level for them to opt out, which is ultimately ends up creating a discussion that it devolves into a public safety discussion based upon the myths and stigma and discrimination about mentally ill people being dangerous. We know that the fact is that it just simply is not true. It is a myth that the mentally ill do not constitute a danger to society. Forced treatment also causes trauma and will have a chilling effect on help-seeking behaviors. There are also a number of true evidence-based practices that we can employ, and our agencies do this every day of the week, called assertive outreach and engagement, as well as peer support, where we go out and we meet people where they're at to bring them into voluntary services. The reason that you see artificial evidence that supports outpatient commitment is that it's not comparing it against a similar service that's offered voluntarily. So all of the research shows that when you offer the service voluntarily, and there's no difference in the outcomes between people receiving it voluntarily and people receiving it under a court order. So it's really important that we understand what evidence means. And I will close with a statement from Dr. Rowe with the Journal of the American Academy of Psychiatry and the Law, where he says, on balance, after more than 20 years of mandates and programs, outpatient commitment remains a costly, coercive, and unproven approach. Much more promising and proven practices are available, and CASRA would urge you to vote no on this bill, although we understand it's well-intended.
Sorry, I'm short. Mr. Chair, members, Jolene DeVoris on behalf of the Urban Counties Caucus. We have an opposed unless amended position on the bill. We don't have any problems with extending Laura's Law. We've been in support of Laura's Law in the past. The problem we have is forcing each county board to take it up and deny it. 5 urban counties have already adopted Laura's Law in the past 2 years. Conversations are ongoing right now, or in some counties have adopted alternatives, so we just don't think that section of the bill is necessary, and it would mandate new costs. Laura's Law has always been permissive, and we would like to continue it to remain so. Thank you.
Additional witnesses in opposition?
Well, since we have a little bit of time left on that bill, I just wanted to add that it's really important that we don't conflate the coercive nature of these services with the actual services themselves. The services that people receive through these programs are really very similar to what is called full-service partnership services that are available under the Mental Health Services Act, Prop 63. And those services are highly effective and evidence-based. But the coercive nature of these services is not the part that is evidence-based, and it's very, very important to point that out.
Thank you. Additional witnesses in opposition. Please state your name, organization, and position only.
My name is Sally Zinman. I'm the Executive Director of the California Association of Mental Health Peer-run Organizations. I'm opposed to this bill, and I think the vast plurality of mental health consumers around the state are also, and the bill directly affects them.
Thank you.
Hello, I'm Megan Wheelahan, Patients' Rights Advocate at the Mental Health Advocacy Project of the Law Foundation of Silicon Valley, and we are in opposition. Thank you.
Good afternoon, Adrienne Schulten, County Behavioral Health Directors Association. We also have an opposed unless amended position as reasons articulated by Urban Counties Caucus and California State Association of Counties.
Evelyn Abu-Hassan, Senior Legislative Advocate with Disability Rights California, in strong opposition to the bill. Thank you.
Amanda Levy on behalf of the California Psychological Association, also opposition.
Matt Gallagher, a youth advocate for Mental Health America of Northern California, also in strong opposition.
Thank you. Additional witnesses in opposition? Seeing none. Any comments or questions from the committee? Member Patterson.
With regard to the request from the rural counties, is that an amendment, a change that you would be willing to accept? The rural county request.
We're glad to work with people, but the point of the bill is to go statewide, and if counties want to opt out, then they would be able to opt out. So to take that amendment would, in essence, would be at status quo.
Okay.
Okay.
Member Chu.
Thank you. As I had shared with the author, Laura's Law is an issue that we've struggled with in San Francisco. In fact, a number of years ago, when I was a president of our San Francisco Board of Supervisors, we debated this for many months, and a large majority of our board chose to vote it down. That being said, 4 years later, because the issues that we saw were not being addressed, we were able to come to a breakthrough and did move forward and support it. That being said, as I did tell the author, I know that there are still some concerns that have been raised by authorities and individuals within my district. I'm okay with supporting to get this out of committee. I do serve on the next committee that this is going to go to, and will likely bring some issues to potentially to be worked through at that time. But thank you.
Thank you. Additional comments or questions from members? Seeing none, Member Eggman, would you like to close?
Just thank the committee for hearing this today. I thank people who came out on both sides, and I know there's been a lot of work over the years that's gone into this. And just one thing I'd like to respond to, I am in no way saying that outpatient treatment that is not mandated is not effective. It certainly is, and we certainly have a lot of evidence that talk about all different kinds of treatment modalities that are very evidence-based and effective, but sometimes they're not when people don't comply with treatment or choose to take part in treatment. So that is for that demographic only. We're not forcing people who are already in voluntary treatment programs into anything else. I respectfully ask for your aye vote.
Thank you, Assemblymember Eggman. Thank you for bringing this important bill forward, and I appreciate your leadership and passion on this issue. We can entertain a motion.
Second.
We have a motion. We have a second. The motion is due pass to Judiciary Committee. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Bonilla? Burke? Aye. Burke, aye. Chavez? Chu?
Aye.
Chu, aye. Gomez? Gonzalez? Aye. Gonzalez, aye. Hernandez? Lackey? Aye. Lackey, aye. Nazarian?
Patterson. Patterson, aye. Ridley Thomas. Ridley Thomas, aye. Rodriguez.
Aye.
Rodriguez, aye. Santiago. Santiago, aye. Steinnorth. Thurmond. Waldron. Wood.
Aye.
Wood, aye.
Congratulations, Assemblymember Eggman. The bill passes 10-0. When you're ready, please feel free to present on AB 1194.
Thank you all very much. So it's the second mental health bill you will hear today, and hopefully the last one. This one is dealing with the Letterman-Petrus Act, LPS Act, which allows for involuntary commitment and treatment of an individual with a mental disorder. And as people, I'm sure, probably know, the purpose of involuntary commitment is to provide for prompt evaluation and treatment, the protection of the individual and their rights, and to ensure public safety. It's the application of 5150 that we're here to talk about today. We have had legal findings when we talk about imminent danger. A lot of counties and clinicians interpret this in different kinds of ways. And again, I know families have been frustrated. Oftentimes clients after the fact have been frustrated, and treatment providers have been frustrated if they're not able to look at the history of danger and what they are able to turn imminent. We used to say in treatment sometimes if somebody didn't come in saying they were going to kill themselves with a knife in their neck, you couldn't 5150 them because it wasn't imminent danger at that time. When we clearly had a pattern, we clearly had an escalation. So that's just what this bill does, to be able to say that clarifies that danger or risk of harm shall not be limited to imminent or right in that moment to themselves or others, and requires consideration, and only consideration, of the historical course of a person's mental health issues. And that finally, this bill would require the 5150 custody form to record whether the historical course of the person's mental health issue was considered. And I think and ask for your aye vote when we're at that time, but we do have witnesses.
Thank you. Yes, Randall Hager again from the California Psychiatric Association. It's interesting that the companion bill to Laura's Law was a bill called AB 1424 back in 2001, and it required, and it is current law because it did get signed into law, it required the consideration of history and family input when it's given and it's available. We have observed, when I say we, psychiatrists, but others have also observed over the years that that bill has been one of the least impactful bills because nobody is aware of it. People just simply do not know that the assessment of a current risk of harm does entail taking into account the person's history, psychiatric history, their character. There have been a lot of instances, I think, in the media where police, sheriffs have shown up. They've interviewed a person. That person has been able to maintain and hold themselves together for a 20-minute interview. They leave, and then that person is very clearly actively dangerous. So the two things really go together. The fact is that harm cannot be imminent, and yet there can still be a very present risk of harm. The present risk of harm does include all kinds of things. So the idea here really is to go back to what I think is the intention of the original framers of the Letterman-Petrus Short Act. It's also in concurrence with a Legislative Council opinion that harm cannot be narrowed to immediate, that's impermissible, that's not the function of the statute. And that helps, I think, also, as Laura's Law does, provide an avenue for earlier intervention into the arc of behavior before it becomes so overt that that knife sticking in the neck or whatever is imminent, and you cannot roll the film back on that incident. So at this point, I'd like to turn it over to Dr. Sugarman.
Hello. Hello, once again, Dr. Tom Sugarman, representing the California chapter of the American College of Emergency Physicians, in favor of this bill. It makes no sense to not consider history when making decisions medically or psychiatrically. And another quick story is that even in patients who want help, sometimes because of the way the laws are written and the process is done, and the psychiatric hospitalization availability, if they show up in a non-designated emergency department without a psychiatric facility, it is not possible to get them help unless they're put on a hold. Typically, that hold is released once they get to the psychiatric facility. But again, true story, I had a patient who wanted help, told me, I'm not suicidal now, but every time I get like this, if I don't get help I need, I will become suicidal within a few days. I'd like to stop that cycle. And there was no way for me to get her the help that she needed. We had to essentially say, you need to drive yourself over to the psychiatric hospital with your family rather than me arranging for her to go over there because of the way the law is written currently. So this should be fixed for the well-being of all patients. Thank you.
Thank you. Additional witnesses in support.
Mr. Chair, members, Aaron McGuire on behalf of the California State Sheriff's Association. If these people don't get the help they need, they end up in the county jails, which is not the best treatment outcome. We urge your support. Thank you.
Stuart Thompson, California Medical Association, strong support.
Judy Wolin with California Hospital Association in support.
Douglas Dunn, Contra Costa County, NAMI Contra Costa, because of terrifying personal experience in this area, very strongly support. Ask for your aye vote. Thank you.
Marianne Bernard, mother of a severely mentally ill California man, former lawyer for state mental hospitals in another state, in strong support on behalf of mentalillnesspolicy.org. And people die. They die. They don't just end up in jail if you don't help them.
Justin Peterson, citizen of Alameda County, in strong support.
Doug Chiappetta, Union of American Physicians and Dentists, would absolutely in support.
Kobe Pizzati with the California Association of Psychiatric Technicians in support.
Additional witnesses in support. Seeing none. Witnesses in opposition.